Hello dear friends, how are you doing today? I hope you are doing well. Today we are going to talk about some uncommon dermal and subcutaneous growths. Glomus tumor. Glomus tumor or Lymphangioma is a benign growth or vascular smooth muscle which produces solitary or multiple flesh-colored to dusky blue nodules. Solitary glomus tumor is frequently extremely tender, occurring on the arms, fingers, or subungual and elsewhere. Multiple glomangiomas are usually non-tender and may be inherited as an autosomal dominant trait. Glomus tumor, dusky blue, non-tender papules and nodules. Granular cell tumor. Granular cell tumors usually present in dark-skinned, middle-aged women and are benign in their great majority of cases. It is found in the skin and the tongue, most frequently as a solitary, asymptomatic nodule. The biopsy reveals large polyhedral cells with a characteristic granular cytoplasm. Granular cell tumor, reddish yellow firm nodule. Infantile digital fibromatosis. This is a rare benign tumor or myofibroblast that occurs at birth or usually by the age of 1 year. The biopsy reveals spindle-shaped cells with characteristic eosinophilic inclusion bodies. These asymptomatic nodules affect the fingers and toes. Surgical excision is usually unsuccessful because of a high recurrence rate. Infantile digital fibromatosis, firm, red, smooth nodule. Leiomyoma. Cutaneous leiomyoma is a benign, smooth muscle tumor that is characteristically painful. It can be solitary or grouped, an autosomal dominant familial form or hereditary leiomyomatosis and renal cell carcinoma or multiple leiomyoma is associated with uterine leiomyomas and renal cell cancer. This is caused by a germline mutation in the gene encoding fumarate hydratase. Leiomyoma, grouped pink tender papules. Lymphangioma circumscriptum. This uncommon benign lymphatic tumor usually arises in infancy or early childhood. It is characterized by irregularly grouped vesicle-like papules that are linked to frog spawn. Trauma can result in weeping, clear colorless lymph. They also may be colored purple if filled with blood. These superficial lymphangiomas are frequently connected to deeper lymphatic cisterns, which makes treatment more difficult. Lymphangioma circumscriptum, irregularly grouped, translucent and red papules. Myxoid cyst. Myxoid or digital mucous cyst occurs as a solitary, opalescent or flesh-colored nodule. It is found over the distal interphalangeal joint or proximal nail fold, where it can cause a characteristic nail plate groove. Puncture of the cyst results in a clear, viscous, sticky drainage. Connection with the underlying joint space makes treatment disappointing unless careful excision is accomplished. Myxoid cyst, opalescent nodule of the proximal nail fold producing a characteristic groove or the nail plate. Clinical case. This 81-year-old man developed this painless pink ulcerated nodule on his lower leg a couple of months ago. He otherwise felt healthy and the general physical examination was normal. What is your differential diagnosis? The first concern is whether this nodule represents a malignancy. If the patient was immunosuppressed or had a history of trauma, then an infectious or physical etiology could be considered. What diagnostic workup would you do now? A skin biopsy is the next logical step. It revealed a dense dermal hyperchromatic lymphoid infiltrate of CD20, BCL2 and BCL6 positive B cells. Further workup revealed a normal complete blood count and a metabolic profile. A positron emission tomography or computed tomography whole body scan showed enlarged lymph nodes in their neck. What is your diagnosis and how would you treat this? The diagnosis is B-cell lymphoma leg type. This lymphoma occurs in the elderly and has an overall 60% survival at 5 years. Treatment depends on the extent of the disease and can be local radiation, chemotherapy, and rituximab alone or in combination. Important points: consider a malignant neoplasm as the cause of nodules, especially if they are firm, dermal, and eroded. A skin biopsy is an important diagnostic tool. Okay, this was a short explanation about uncommon dermal and subcutaneous growths. Thank you for your attention.